Hey, Dr. Casano, it's Patrick Lenny here, 10/23/2014. I'm going to be checking cranial nerves 1 through 12. Alright, so first I'm going to check cranial nerve 1. I'm going to see how your sensory of smell is. So if you could take one hand and place it over your nose, and breathe in, and then do the same thing on the other side. Alright, now close your eyes. Okay, take one hand and do the same thing. Alright, now breathe in. Okay, now on the other side. Breathe in. Okay, now first, can you tell me what that was?
Coffee?
Okay, and did you smell the same on both sides? Okay, great. Alright, so now I'm going to be doing, I want you to take your hand over your eye, and I want you to tell me, if, I'm going to put a number up, I want you to be able to tell me what that number is. Okay?
1, 2, 1, 5. 5.
Alright, great. Then I'm going to do the other side. Alright?
1,
Okay.
1, 1, 5, 1.
Okay. And I'd ask the patient to look directly at me, so she was looking at me, that way I could check her field of gaze. Next I'm going to do H in space, so I want to make sure I'm far enough away that her eyes aren't converging. And I have her follow my finger, and follow my finger. And right now I'm going to be checking for nystagmus. Now I'm going to converge. Okay, good. And her eyes said, okay, no nystagmus and convergence. Next thing I'm going to check is pupillary fatigue. I'll turn this on. And then I kind of stand to the side here. Just check. I'll come to the other side. Check. You don't want to hold the light too close to her eye. Basically, an abnormal response is going to be you flash the light in her eyes, it may constrict. Second time you flash your eye, it doesn't constrict due to fatigue, whereas a normal response is going to constrict every time you flash the light in their eyes. Now I'm going to have her close her eyes, and I'm going to be checking for blepharospasms, which is where the eyelid will flicker like a spasm. And next, basically I'm going to take this, you can open your eyes. I'm going to take this pinwheel, and I just want to show you that it's not sharp or anything, it's not going to hurt you. But I'm going to be checking for sensory on both sides, as well as pain. So go ahead and close your eyes for me. I want you to tell me if it's the same on both sides.
It's the same.
Okay.
Same. Same.
Okay, great. Now, I just want to make sure that it's the same. I'm going to use a different object. I'm going to use a cotton ball here. I just want you to close your eyes again. Tell me what you feel.
It's the same on both sides.
Okay, no pain. Okay.
Same.
Okay. So now I'm going to go ahead and check for muscles and mastication. So I want you to go ahead and squeeze down for me. Okay, now squeeze again. Okay. Now what I want you to do is don't let me close your mouth. Okay. Now I want you to raise your eyebrows. Okay, and then I want you to squeeze your eyebrows. There you go. And then smile. All right. And what's the funniest thing you heard today? Perfect. That's all I needed. Just a little smile. All right. And next, I'm going to check for hearing loss. So basically, I'm going to take my fingers like this, and I want you to tell me if it's the same in both ears and when you stop hearing it. Okay? Good. Close your eyes.
No.
Okay. And basically, if the patient didn't heard it louder in one ear and didn't hear it, I'm going to go to Weber's and Rhiann's test. So first I'll do Weber's test. I want you to tell me if you hear this the same in both ears, or if one's louder.
The right one's louder.
Okay, so our right ear is louder. So now I'm going to go to the right side, or the loudest side. And that would Take the left. And I'm going to start on the mastoid and check for bone conduction. Tell me when you stop hearing that.
Right now.
Okay, and then we'll move to the front. Okay, now which one did you hear it in first? Or which one did you hear it louder in, sorry?
The one up here.
Okay, the one up there. So basically what you're testing for is if there's bone conduction loss, which would be conduction loss on the ipsilateral side, she would hear it louder in the back, but since she heard it louder in the front, it's going to be a neurosensory loss on the opposite side. Next thing I'm going to have you do is I'm going to check your gait, so I'm going to have you come stand over here for me, and I want you to walk and touch heel to toe, and I want you to stare straight at me, and go ahead and walk towards me. Okay, now go ahead and go back. And then this time I want you to close your eyes. And then I want you to walk towards me. And then when you get to me, open your eyes. That way I can check for nystagmus. She's got a little bit of a lean to the right. And I see no nystagmus. Okay, so next thing I'm going to check is her mouth. And so I'm going to have you go ahead and open your mouth. I'm going to shine the light in. I want you to say ah, 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 until I tell you to stop. Okay, go ahead and open your mouth.
Ah, 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 ah.
Okay, perfect. And right there I'm checking for palatal paralysis. Next thing I'm going to check for is, same thing, I want you to stick your tongue out as far as you can. Alright, so here I'm checking for atrophy of the tongue or any kind of deviation, as well as fasciculations, and I see none of that, so that's good. Alright, so now I'm going to also test for her strength of her tongue, as well as check the gag reflex. First thing I'm going to do is have you open your mouth and try to take your tongue and press it against that. Okay, same thing. Okay, and do you mind if I check your gag reflex? Okay, back. Okay, it works. Good news. And then I want you to go ahead and puff your cheeks for me. Okay, good. And then next thing I want you to do is the SCM and traps. So go ahead and lift up for me. Okay. And then go ahead and take this, press this hand on my hand. Okay, good. Press that into my hand. Okay, good. So first test is checking for traps, and the second one was checking for SCM. And then I'm going to do a test that I forgot to do. And that's going to be getting this thing to work. Okay, so I'm going to go ahead and take a look into her eye bilaterally, and I want to make sure, this I'm going to take my glasses off for, and I'm going to make sure. Do you mind if I take a look in your eye?
Go for it.
Okay. So here I'm going to be looking for papillary edema, as well as hemorrhaging and baby nicking, as well as some other things, but those are just the most common. So here I'm going to go in, try to take a look. Okay, I see nothing in that eye, everything looks normal. Okay. And let me just make sure I've gone over everything, and I believe I have, so that's the end of my video of cranial nerve 1 through 12. My name's Patrick, today's date is 10/23/2014, and my favorite instructor is Dr. Cusano.